Hello, my name is Dr. Ellen Leibenluft. I'm a member of the Scientific Advisory Board of the International Bipolar Foundation, and I do research on children with bipolar disorder or severe irritability. I do that research at the National Institute of Mental Health in Bethesda. The question is, how can we tell the difference between bipolar disorder and extreme irritability in children? And the answer has to do with something called episodes. Bipolar disorder is an episodic illness. What that means is that people with bipolar disorder have some periods of time when they're manic and some periods of time when they're depressed. And during those periods of time, their mood is different from what it usually is. For example, if you have a manic episode, your mood is much more elevated, much happier. It could actually also be irritable. And at the same time that your mood is different from what it usually is, there are also all these other symptoms that change at the same time. So while you're also more happy than usual, you don't need as much sleep, your thoughts are going very rapidly, you're talking very rapidly, and all these different symptoms come together, and that's an episode. And children who have bipolar disorder, just like adults who have bipolar disorder, have these episodes of mania or of depression. Children with severe irritability don't have episodes. Every day is pretty much like every other day. They're very irritable. It may be a little bit different from one day to the next, but it's basically pretty much the same. They tend to be very irritable children. Everyone thinks of them as that way. When they grow up, they are not at increased risk to have bipolar disorder. These irritable children, when they grow up, are instead at risk to have depression, the kind of depression that you just have what's called unipolar depression, not related to bipolar disorder. They tend to have unipolar depression and anxiety disorders, but not bipolar